Have you ever woken up in the middle of the night because your hand went numb? That tingling, pins and needles, feeling in your thumb, index, and middle fingers, so intense. You have to shake your hand just to get feeling back. Some people wake up in real pain and spend several minutes rubbing their hand before they can fall back asleep. If this has been happening not just once, but night after night for weeks or months, today's video is exactly what you need. Today we'll cover what's actually causing this nighttime numbness, and a simple wrist positioning method you can start tonight. Stick around, because later I'll share warning signs that mean it's time to see a doctor, plus a simple 7-day plan. This pain comes from something called the median nerve, which runs through a narrow passage in your wrist called the carpal tunnel. Tendons that move your fingers pass through this same tunnel, alongside the nerve, which controls sensation in your thumb, index, middle, and part of your ring finger. When pressure builds up inside that narrow tunnel, the nerve gets compressed, and that's what produces tingling, numbness, and reduced sensation, a condition known as carpal tunnel syndrome. Here's what surprises people. Why does this get so much worse at night? While you're awake, you unconsciously keep your wrist in a reasonably neutral position. But once you fall asleep, that control disappears, and many people end up holding their wrist bent sharply, either curled inward or bent back, for hours without realizing it. That bending narrows the tunnel and increases pressure on the nerve. Research has repeatedly found a clear link between sleeping with a bent wrist and nighttime numbness, and studies have identified both higher body weight and bent wrist sleeping position as independent risk factors for this kind of symptom. Many people assume this numbness is just poor circulation, but the real driver is physical nerve compression, closely tied to wrist angle. That's exactly why how you position your wrist during sleep plays such a decisive role in reducing symptoms. Several factors contribute here: repetitive wrist use, long hours typing or on a phone, vibration exposure, pregnancy or thyroid issues that increase fluid retention, and excess body weight. Women experience this more often, likely because the tunnel itself tends to be narrower. But out of everything, the one thing you can change tonight is your wrist position while you sleep. So how do you actually position your wrist? The key isn't finding a special angle, it's avoiding any bent angle at all. A neutral position, where your forearm and the back of your hand form a straight line, keeps the tunnel at its widest and pressure on the nerve at its lowest. Since maintaining this on your own through the night is essentially impossible, a wrist brace or splint is what physically holds that position for you. When wearing a brace, make sure the rigid support runs straight along the center of your palm and forearm. If it's twisted to one side, it can press on nerves or blood vessels in the wrong direction. Fasten it snugly but not too tight. Your fingers should move freely and circulation shouldn't be restricted. Research shows no single brace design is clearly superior to others. So if your first one feels uncomfortable, trying a different style is perfectly reasonable. Here's what you're probably wondering. Wearing a brace to bed can feel awkward at first, since your brain is used to full wrist freedom during sleep. The first 2 or 3 nights, you might actually sleep worse. But most people stop noticing the brace within 4 or 5 nights. And the reduction in numbness and pain far outweighs that early discomfort. Don't expect dramatic results night 1, give it at least a week before judging. Research has repeatedly identified nighttime wrist bracing as the first conservative treatment to try for mild to moderate carpal tunnel syndrome. Randomized controlled trials have found that patients using a night splint showed meaningfully better sleep quality measures compared to those without one, though the degree of improvement varies by individual. Now, what can you do starting tonight? First, make wearing your wrist brace before bed a habit. Center the support along your palm and forearm, fasten it snugly, without restricting finger movement or circulation. Second, pay attention to your sleep position. Sleeping on your stomach or with your hand under your pillow tends to force your wrist into a sharply bent position. Try to keep your hand resting naturally at your side or on your stomach instead. Interestingly, research on people with this condition found that side sleeping was strongly associated with the condition. So if you sleep on your side, pay extra attention to your wrist angle. Third, reduce repetitive wrist strain during the day. Long hours on a keyboard or phone with your wrist bent can worsen nighttime symptoms. Keep your wrist level with or slightly below your keyboard, and consider a wrist rest. When using your phone, try resting it on a table or your lap, rather than gripping it tightly in a bent wrist position. Fourth, try simple nerve gliding stretches during the day. Extend your arm, palm up, and gently pull your fingers back with your other hand until you feel a stretch through the inside of your wrist. Hold 15 to 20 seconds, repeat on the other side. Slow wrist circles in both directions a few times a day also help keep the joint from stiffening. Fifth, know how to respond if numbness wakes you up. Gently shake your hand or slowly open and close your fist while wearing the brace. This often relieves the pressure and eases numbness gradually. Avoid forcefully bending or vigorously massaging the wrist itself. Gentle movement is safer. Sixth, check your sleep setup. A pillow that's too high or too low throws off your shoulder and arm position, which affects your wrist too. Supporting your arm with a thin cushion can help keep everything in a more neutral alignment. Here's a common mistake. Some people wear their brace all day and stay just as active with their hands, which can actually create new strain elsewhere. While some studies found benefit from wearing it both day and night, the general recommendation is nighttime. Wear with normal wrist movement during the day, unless your doctor advises otherwise based on your specific case. Everything we've covered today is genuinely useful for managing mild to moderate symptoms, but it isn't a cure-all. Numbness can also stem from a pinched nerve in the neck, diabetes-related nerve issues, or other causes. See a doctor if any of these symptoms haven't improved after several weeks of consistent bracing, or they're getting worse. The muscle at the base of your thumb feels noticeably thinner or weaker, making it hard to grip things. Numbness spreads across your whole hand or into your pinky, which suggests a different nerve issue. Neck or shoulder pain accompanies the hand numbness, or your hand changes color or swells alongside the numbness. That thumb muscle change is easy to miss but important. Compare both hands side by side. If one looks noticeably flatter at the base of the thumb, that can mean the nerve has been compressed long enough to affect the muscle it controls, and that calls for prompt medical attention rather than continued self-care. If you have diabetes, pay extra attention since nerve issues can overlap, and reduced sensation may make it harder to notice symptoms accurately. Thyroid problems are also worth knowing about, since low thyroid function can cause fluid retention. That adds pressure inside the tunnel if numbness comes with unusual swelling, fatigue, or weight change. Ask your doctor about thyroid testing too. For those already seeing a doctor, nerve conduction studies can objectively measure how compressed the nerve is. Mild to moderate cases usually start with nighttime bracing, sometimes alongside anti-inflammatory medication or a local steroid injection. If symptoms are severe or don't improve, surgery to widen the tunnel may be considered, and research has found that surgical patients showed greater improvement in sleep quality measures than those using a brace alone, though surgery is typically a later option after conservative approaches have been tried. Be patient with the process. This condition usually develops gradually, so expect to give consistent nighttime bracing 2 to 4 weeks before noticing real change, with maximum benefit often building over 8 to 12 weeks. Here's a practical 7-day plan. Days 1 and 2, get your brace and practice fitting it correctly, checking the support sits centered and isn't too tight. Days 3 and 4, build the nightly bracing habit and start paying attention to daytime wrist posture. Days 5 and 6, add nerve stretches and wrist circles 2 or 3 times a day. Day 7, check in with yourself. Are you waking up less often? If nothing has changed, or your grip feels weaker, book a doctor's appointment that week. Consider keeping a simple note each morning, just how many times you woke up, and whether the numbness felt severe, moderate, or mild. Small changes are easy to miss day to day, but a week of notes makes the pattern clear, and gives your doctor useful information if you do seek care. We use our hands constantly all day, yet we rarely think about what position our wrist holds while we sleep, since we can't consciously control that once we're asleep. This is exactly why a brace matters. It's not about restricting your wrist, it's about giving that nerve genuine rest. Try this tonight, and if you've had a similar experience, or found something that worked for you, share it in the comments. I'll see you in the next video with more health information you can actually use. If this helped, a subscribe and a like go a long way. Thank you for watching.